Mike Pence, who, by the way, is the leader of the coronavirus task force, reportedly told the state's governors on a private call to lie to their constituents and say that the rise in testing is behind the new coronavirus outbreaks. But that is a lie, a dangerous lie at that, as Republican governors are bound to listen, and it's a lie just to cover up Donald Trump's ass. Here's an actual doctor giving you the facts on the ground.
This pandemic of misinformation, saying that we've got it under control and that an increase in cases is simply from an increase in testing is just not true. We have an increase in the proportion of positive cases that is exceeding what we have had before, meaning we have had more cases that have turned positive despite increasing tests. And that's unlike New York State or Italy, where we have triple the volume of testing, but a much lower rate. So they're just obfuscating the facts. And the CDC and other public health officials have either been silenced or they've just not been allowed to speak up, even despite knowing the facts.
And here's the chart that Dr. Patel referenced there a little bit. You can see how Italy, Germany, and Spain flattened their curves in a similar time frame, and how the United States is just lingering and plateauing in a sense a little bit. A lot of that has to do with cases dropping in original hotspots in blue states like New York, and sharply rising in red states, places like Arizona, Florida, etc. And part of that is because they have reopened way too hastily. And this is just echoing Donald Trump's absolutely nutty claim yesterday that if we stopped testing, we'd have very few cases, if any. To me, that was just him botching the talking point that Mike Pence more slickly articulated reportedly in this call, basically that the increases in testing is just reporting cases that were already there. And in reality, if we were to have tested every single American, cases would be going down. But that is not necessarily the reality that scientists are saying it is existing in reality. I would just encourage you all, as we talk about these things, to make sure and continue to explain to your citizens the magnitude of increase in testing, Mr. Pence said on a call with governors, audio of which was obtained by the New York Times. And that in most of the cases where we are seeing some marginal rise in the number, that's more of a result of the extraordinary work you're doing, but also encourage people with the news that we are safely reopening the country, that as we speak today, because people are going back to hospitals and elective surgery and getting ordinary care, hospitalization rates may be going up. Oh my God, it's such a lie. But according to our most current information, hospitalizations for coronavirus are going down across the country. In fact, 7-day averages in several states with coronavirus outbreaks have increased since May 31st. And in at least 14 states, positive cases have outstripped the average number of tests that have been administered, according to an analysis of data collected by the New York Times. Data from the Centers for Disease Control and Prevention show that coronavirus hospitalizations have decreased nationally, though positive cases have increased, and the number of deaths attributed to the disease caused by the coronavirus, COVID-19, could increase as more data becomes available. So I like to point out all the time that this is how propaganda works. Look at how Pence hinged on that hospitalization number, even though they all know it. The data is enormously clear that cases are going up in red states where they hadn't experienced the coronavirus outbreak before, and maybe perhaps citizens of those states were more likely to dismiss it as a hoax. And that's why Trump wants to go back on the campaign trail and pretend like everything's normal, even though people are talking about this as the second wave. We're still in the first wave. We're still in the first wave, and we're gonna have a second wave, likely in the fall/winter, and a vaccine's not coming until earliest 2021. Seriously, guys. So it amuses me that, one, Trump botched the talking point when he said that insane quote yesterday where they're trying to just claim that testing is just highlighting cases that weren't reported before or whatever. But how Pence is trying to be slicker about it, and even that I feel like is so easy to read through. And luckily there were some people on this call, likely blue state governors, who leaked the contents of this to the New York Times, because otherwise we would not be able to have insight into how Pence is trying to indoctrinate these governors to push Trump administration propaganda. Which, like 40 to 50% of them will definitely do.